Hello guys, my name is John Lloyd D. Delarna, student nurse from Wesleyan University, Philippines, and today I'm gonna show you how to take the vital signs. And without further discussion, let's get into intro. So the purpose of this is to obtain the temperature, heart rate, respiratory rate, and blood pressure. And also to obtain the baseline data for subsequent evaluation. For temperature, assess for the following. For oral route, the intake of hot or cold beverages or foods. If client had smoked, if client is undergone oral surgery, the age of the clients, if very young, child, if client has persistent vomiting, if client has disease affecting the oral cavity. For axilla route, if the client has undergone surgery in the axilla, if client has profuse sweating, if client has abscess in the axilla or pain in axilla. For rectal route, if client has undergone rectal surgery, if client has diarrhea, if client has disease such as myocardial infarction, if client has hemorrhoid. For pulse, check for the rhythm, strength, and rate. In neonates, assess for apical pulse while in child, check for presence of brachial pulse. For respiration, in adults, observe the rising and falling of the chest wall. In pediatric clients, assess for the rising and falling of the abdomen. Assess for symmetry, chest indrawing and labored breathing. Assess for the position assumed by the patient while breathing. For blood pressure, ask about the previous activity of the client, intake of hot or cold beverages or food, type of diet of the client, emotional status of the client, check the position of the client while taking BP, assess the arm circumference of the client, check the availability and functionality of the materials needed, check for the level of consciousness of the client and the level of understanding. Planning. Gather the following: BP apparatus and stethoscope, thermometer, cotton ball with alcohol in canister, canister for soiled cotton ball, and use thermometer, watch with second hand towel. Assemble your equipment and supplies, identify clients, introduce yourself, explain to the client what you are going to do, why is it necessary, and how he can cooperate. Wash hands and observe other appropriate infection control procedures. Provide client safety and privacy. Place client in most appropriate position. Assessing for body temperature. Select the most appropriate site for the measurement. Wipe with cotton ball from cleanest to dirtiest. Then place thermometer. Wait for the appropriate amount of time and remove the thermometer. Wipe the wet cotton ball cleanest to dirtiest. Read the temperature within eye level. For assessing peripheral pulse, select the most appropriate pulse point. Palpate, placing 2 or 3 fingertips and squarely over the pulse point. Count the rate for 1 full minute. Assess the pulse rate, rhythm, and volume. Assessing respiration. Observe or palpate and count the respiratory rate for 1 full minute. Observe the depth, rhythm, and character of the respiration. Assessing blood pressure. Wrap the deflated cuff evenly around the upper arm. Locate the brachial artery. Apply the center of the bladder directly over the arm, over the artery. Perform a preliminary palpatory determination of systolic pressure. Palpate brachial artery. Palpate brachial artery. Close valve and pump up the cuff until you no longer feel the pulse. Note pressure and completely release pressure over the cuff. Position stethoscope appropriately. Place the bell of stethoscope over the brachial pulse. Auscultate the client's blood pressure. Pump up the cuff until the noted pressure and add 30 mmHg. Release the valve decreasing 2 to 3 mmHg per second. Identify the Korotkoff sound. Deflate the cuff rapidly once the measurement is taken. Position patient comfortable, provide privacy and safe. After care of equipment, do hand washing and document vital signs. For evaluation, report any significant change to client's vital sign to the attending physician. Relate findings to previous assessment data and health status. Carry out doctors or based on the physician's or